excited for today's topic, which is something I'm incredibly passionate about. Black women's health. Eden, seriously, this is such a vital conversation, right?
Indeed, Avery. It's a critical area of focus. Black women's health encompasses the unique challenges and systemic inequities that often lead to poorer health outcomes for this demographic.
Unique challenges? Wow, like what are some of the biggest, most glaring disparities that Black women face in healthcare? I'm thinking, are we talking about like specific conditions or just general access?
Both. For example, Black women are 3 to 4 times more likely to die from pregnancy-related complications than white women. Conditions like uterine fibroids, hypertension, and certain cancers also disproportionately affect Black women, often with earlier onset and greater severity.
3 to 4 times? That's just heart-wrenching. Seriously, what's being done to tackle these deeply rooted issues? Are there like amazing new programs or research initiatives specifically targeting these disparities?
Yes, there are. A growing number of organizations, researchers, and advocates are working to address these systemic problems. Efforts include promoting culturally competent care, increasing funding for specific health research, and developing community-led initiatives to improve access and education.
That's incredible to hear. It gives me hope. So what can we do as individuals? Can we play a role in supporting Black women's health, or is it more on like a policy and medical system level?
Individual action is vital, Avery. Supporting Black-led health organizations, advocating for equitable healthcare policies, and promoting health literacy within communities all contribute to meaningful change. It truly is a collective effort for a healthier, more just future.
Good evening and welcome to Black Living Room Talk, the podcast where we focus and center with conversation, stories, and information. I am your host, TBwahid, and this evening we are diving into the realities, challenges, and triumphs of Black women's health in America. From maternal mortality to mental health, we're talking about what it means to survive, thrive, and heal in a system that wasn't built for us, but is being reshaped by us. And I know you heard my two little people speak, Avery and Aiden, but I want to go further for a second and expound on the things that they were talking about. Let's start with the facts. Black women in the U.S. face some of the most severe health disparities of any group. We are 3 times more likely to die from pregnancy-related causes than white women. We are more likely to suffer from chronic conditions like hypertension and diabetes. And we're less likely to be believed when we say, "I'm in pain." But these numbers don't tell the whole story. They're rooted in a long history of medical racism, neglect, and systemic inequality, from the exploitation of enslaved women in early gynecology to the dismissal of our symptoms today. The healthcare system has often failed us. There was a Black woman, doctor, nurse, activist, patient, and advocate, and she said she'd had patients tell her they were ignored in the ER until they started crying. She said, "I've had to fight for my own care, even as a doctor." These stories are powerful. They remind us that while the system is flawed, Black women are not passive victims. We're advocates, healers, and warriors. Let's talk about mental health. For generations, Black women have been told to be strong, to carry the weight of the world, to push through. But strength doesn't mean silence. Mental health challenges like anxiety, depression, and trauma are real, and they deserve care. Yet stigma, lack of access, and cultural disconnects often keep us from getting the help we need. There are amazing therapists, support groups, and wellness spaces led by and for Black women. Healing is possible, and it starts with permission to feel, to rest, and to be vulnerable. So what can we do? Change is happening. Black women are leading health initiatives, creating community clinics, advocating for policy reform, and demanding better care. You can support by amplifying Black-led health organizations, advocating for reproductive justice, supporting culturally competent care, checking in on the Black women in your life. Healing is collective, it's political, and it's personal. So I want to say to you, thank you for joining me this evening if you were joining me and listening. And if this episode resonated with you, share it with someone who needs to hear it. And please continue to follow and listen to Black Living Room Talk for more conversation, stories, and information. And until the next time, remember that healing is in our hands. And please tune in to this Saturday's show where Asada X, my guest, will be back and we'll be talking about more dynamics about relationships, Black relationships. And in the meantime, I want to wish you peace, love, and light. Hotep.